All right. Good morning, everybody. My name is Pete Meitzner. I'm currently serving as the chair of the Sedgwick County Commission, which also serves as a Board of Health. I'm instructed to recognize fellow elected officials and hospital notables. And I was thinking it might be easier, just raise your hand if you're not in the hospital business, and then everybody else. But that said, I do want to. The pro tem, the vice chair, Lacey Cruz is here. Lacey, Commissioner David Dennis is here, my fellow commissioner. I don't know that there's anybody from the city council here. And then obviously we have Dr. Menz is here. Dr. Antonios is here. Back there, Dr. Ebersol from Wesley's here. And a few others. Any other notable medical... Oh, Dr. Gallagher's here. What other doctor am I missing? Anybody? Okay. So thank you for joining us on this this kind of a beautiful morning for the middle of November. We're here to recognize our local heroes this morning who are on the front lines every day of this COVID-19 pandemic. Without them, our community would not be able to function and care for one another. And for that, I'm deeply appreciative. Our local hospital system, our mental health professionals, EMS, and the health department all play a critical role in saving lives on a daily basis. I also want to recognize Adrian Byrne, who helps run our health department. Adrian, thank you for being here. Please allow me to read a proclamation that our commissioners will consider at our next meeting next week. Whereas, since early March, Sedgwick County health care officials, including doctors, nurses, EMS first responders, health department professionals, and mental health professionals have been working the front lines of COVID-19 pandemic. And whereas Ascension Via Christi, Wesley Medical Center, Robert J. Dole Veterans Affairs Hospital, and numerous clinics, immediate care centers, and first responders provide care and support to residents in and around Sedgwick County. And whereas more than 12,000 residents have tested positive for COVID-19 since the pandemic began, fortunately, most of those cases recover without need for hospitalization. However, the people who need hospital support normally find themselves in critical care or intensive care. And whereas our health care and mental health professionals work daily, tirelessly to care for people and make them well, and whereas these dedicated professionals deserve to know how much the community supports them and recognize all of their hard work. So therefore, be it resolved that I, Chairman Meitzner, and the Board of Sedgwick County Commissioners do hereby proclaim November 18th, 2020 as Healthcare Hero Day in Sedgwick County and urge all residents to show their support for our dedicated and compassionate healthcare professionals. We will take this up, and I assume we're going to approve this at our next meeting. So with that, we've got a few speakers. This particular whereas that I read really hits home to me because of and all of us, because since this started, we have been involved daily and for sure weekly communications with our Wesley friends and Via Christi. And we've watched this thing evolve. If you recall, in March, we all thought this would be fine in about 30 days, and here we are in November. And the healthcare people, Lacey and I are well aware of the pressure that the emergency room and the ICU and the nursing staff and the care people, it's been referenced before as kind of a war zone a little bit, but none of these people signed up to fight in wars. So the MASH tents. So these healthcare people are maybe holding the hand or a cell phone of a person as they're taking some of their last breath, trying to communicate with their family that can't be there. So they are under incredible emotional and psychological support and pressure. And I don't know if I'm taking some words away that what are going to be said by some of the doctor professionals, but we're going to now invite them to to say a few words. So first off up will be Dr. Menz, our Sedgwick County Local Health Officer.
Thank you for the opportunity to say a few words, and I will keep them few. One of the things we're battling with this virus is lack of public appreciation for what's going on in the hospitals. By necessity, we're trying to keep everybody in the hospital protected from getting COVID, so our units where these patients are being taken care of is walled off. No visitors are allowed, even family members. So it's somewhat invisible to the public of what our healthcare workers are going through. In our ICUs, our nurses, doctors, and other healthcare providers are working 12-hour shifts with full garb on, mask all day long, full gear, heavy gowns, and they are dealing with not only the medical issues but the emotional issues that these patients are having, and it's a very, very difficult time for them. But they got in the medical profession, they knew that was the case. I don't think many of them foresaw such a thing as this, but they knew that they would have to step up and meet the needs of their patients. I'm not an excellent historian, but I do know that during the Battle of Britain, when the Royal Air Force was almost pushed to the limit of defending the country, after it was completed, Winston Churchill made a statement, something to the effect, "This will be known as Britain's finest hour." And I would say the same thing about this epidemic and the pressure it's putting on our hospitals and our healthcare providers. When this is all over, this will be known as our finest hour. I'd also like to thank the hospitals for all they're doing to keep our educational programs going. I know that's quite a task in this epidemic situation, but it's very important that we keep that educational pathway flowing for our upcoming healthcare providers that will be taking the place of these healthcare providers when they move on. So thank you very much for that, and I appreciate everything that all of you are doing here today to support us in the effort to get this thing under control. So thank you.
Next up, Dr. Antonios from Ascension Via Christi.
Thank you again. At Ascension Via Christi, how our staff chooses to use their skills, training, and talents may be different, but the why is the same. They all have a passion for serving others, particularly those who are most vulnerable. Unfortunately, COVID-19 has made us all vulnerable because any one of us could at any moment become ill, regardless of our age, gender, ethnicity, or where we live. More of us are becoming infected. This week, approximately one out of every 4 people who are getting tested is turning positive, and that's concerning. Long before our current uptake and surge, we started working hard on preparing a multi-phase plan to be ready, and we had hoped that we would not have to use our plans. Back in March, we saw our first surge, and we were able to jump to work hard, and fortunately by the summer we have had an improvement in the numbers. However, we're sitting in a somewhat different place today. In the last month, we've seen increase in hospitalized patients, and we obviously are here to serve our community. Everyone is working very hard. Our staff are incredible people. They are dedicated, and they are wearing all their isolation gowns, their PPE, in very difficult conditions sometimes for 12 or longer hours a day. The staff in the other units are being called upon to be flexible, to be able to move patients and continue to deliver the high quality and dedicated care that they do. Caring for the patients in the COVID-19 unit is a labor-intensive process that involves nurses, doctors, respiratory therapists, phlebotomists, pharmacists, dietitians, and so many other people that I didn't mention. And they all are doing it with great dedication because that's what we do for our community. I am always at awe at the beauty of their souls, their collective resiliency, flexibility, and compassion for our patients is very inspiring, and I'm here to also honor them and ask that everybody remembers our staff at the front line. So please join me in thanking our frontline givers and honoring them. And remember to take notice that our number of cases in COVID-19 requires us to take small actions, washing our hands, wearing our mask, in order to help our community. Thank you.
Dr. Eversole from Wesley Medical Center.
Good morning, everyone, and Commissioner Meister, the rest of the commission, KU, Dean Menz, and all that are here today. Thank you for the invitation today to honor our local healthcare heroes. Above all else, we are committed to the care and improvement of human life. That is the mission statement of Wesley Healthcare and that of HCA Healthcare. And every day, our staff and physicians, all the employees of Wesley Healthcare continue to honor this mission in the middle of a global pandemic that none of us expected to see in our lifetimes. From the ED, emergency department providers that are seeing patients in triage by the dozens, that 1 in every 4 may be COVID positive, to the ICU nurse, some of them here joining me today, that may be sitting, that not maybe have, they have sat with, holding the hand of a dying COVID patient because their family, for their own safety, cannot be there with them. To an EVS worker at Wesley who volunteered to clean the rooms to get them prepared and sterilized in our COVID-19 medical intensive care unit. Forgive me, I'm going to push my mask up. To the dozens of other and hundreds of other healthcare workers, ancillary staff at Wesley that keep the hospital functioning and running every day so that we can continue to care for Wichita, Sedgwick County, our state, and beyond our state lines as well. To the region, we say thank you, and you are truly heroes to all of us. It's been said before in the comments, but I think one of the things, a tangible, simple thing that we all can do to honor our healthcare heroes is to wear a mask. Please do that. Please continue to do so. If you have been, please get a mask and put one on if you haven't been doing that. That honors not only our healthcare workers, our frontline workers, our EMS workers, everyone that is putting themselves and their life on the line every day, but it honors everyone that you come in contact with, whether that's your friends, your families, complete strangers, your neighbors. So I really ask you to do that, take that to heart. We really appreciate the support of the community, of the state, of the elected officials as we all go through this together. And it's just in closing, wanted to thank everyone and appreciate the support, continued support of the community. Thank you.
Next up is Dr. Julie Cotton from the Robert Dole VA Medical Center.
Good morning, everyone. Thank you for having us here this morning. It's certainly a privilege to honor all of the healthcare workers in this community, specifically our VA employees. I think I thank them every day for all that they do, and so I'd like to take a moment to say thank you to all of the healthcare workers for caring for this community. So healthcare workers at the VA have a very special mission. Every day we work to make sure that our veterans receive the merits that they are due. The Veterans Healthcare Administration is a very multifaceted organization. We provide very typical healthcare services for veterans, and then we believe we go a step above and beyond by providing programs to assist veterans who are homeless, who need vocational rehab. We also have a very comprehensive program that supports caregivers of veterans. These are just a few examples of the programs we have to ensure that our veterans are receiving the quality care they have earned and deserve. The VA's first priority is always veteran health care, but we do have what we call our fourth mission, which is to support national, state, and local emergency management, public health, safety, and homeland security efforts. Some of our staff that are here today have participated in these very missions. For example, Ian Chavez, one of our ICU nurses, deployed to both Chicago and Honolulu to support the local hospitals there in managing their COVID patients. One of our nurses, Andrea Lacaus, deployed to support the VA Medical Center in Muskogee, Oklahoma. And two of our VA nursing assistants, Margot Littlejohn and Melissa Carnahan, provided support to the Missouri State Veterans Home in Cape Girardeau, Missouri. So we're very proud of them and their sacrifices. Also, it's certainly been a challenge for our infection control team, represented by Dr. Ossie, Chris Graves, and Kelly Leach. They have definitely been instrumental in keeping our staff and veterans safe during this pandemic. They have relentlessly researched issues, educated our staff on how to avoid the hazards of this new and ever-evolving situation we all find ourselves in today. In closing, I just want you to know that every VA employee finds it a privilege to represent our grateful nation in delivering to veterans the programs, services, and health care that they have earned. It is a privilege to repay our country's debt of gratitude to those who were there when we needed them most. Yesterday was Veterans Day, but at the VA hospital, every day is Veterans Day for us. We pledge never to forget the sacrifices our veterans have so generously and selflessly made for us and our posterity. As we move forward, it cannot be said enough. Please keep yourselves and your families, your coworkers safe by wearing your mask, by practicing good hand hygiene and social distancing. Thank you.
Next up, this lady almost needs no introduction. The famous Carrie Rangers, COVID-19 survivor, Wichita Eagle legend.
I really do appreciate the county inviting me here to speak. I have to say, though, it's really intimidating to talk about a medical condition when there are actual medical professionals here. I'm just going to share my experience, take that for what it's worth. Starting in the second week of March, I started working from home, as almost everybody did at the Eagle. As a matter of fact, this is the first work day I've been out of my pajamas since the second week of March, and I have to tell you, my shoes are killing me. I, from the get-go, took this virus super seriously. As soon as they told us to wear masks, I got masks. I washed my hands like a crazy woman. I have, my entire adult life, suffered from very severe sinus troubles, like 6 to 9 months at a time kind of sinus troubles. Finally feel like I've gotten that under control, but I have to say the virus particularly scared me just because of my ongoing condition. My husband, unfortunately, isn't quite so concerned. Now, he is concerned. He does wear his mask. I don't want anyone to think he doesn't. But early on, I wrote an article for the Eagle about living in a home where one person is super careful and the other one not so much. And I said, I fear, and I really know, my husband's going to bring it home to me. And that's exactly what happened. My husband is, just as a part-time job, a bar musician. He would kill me for saying this, and I really don't want to hurt any business, but I really don't care if y'all close down the bars till this is over, because he not only got it at a bar, he is playing at that same bar again this weekend. So I know he was taking it seriously, but when it came right down to it and I got it, he was scared. And I think it brought a new level of concern for him. It's just like all those stories you hear about people who don't really believe in the virus until they get it. And he believed in it, but he was scared when I got it. And the short version of the story, I almost feel silly being called a survivor because it was really never that bad for me. Shockingly, stunningly, I'm eternally grateful. I had a whole range of symptoms along the way. The biggest and the longest were what everyone says, the fatigue and the achiness. I had some weird things happen. I'm kind of a bit of a crybaby anyway, but I found that like whatever I read, whatever I watched, I just started sobbing. So Joe really tried to stay in the other room for most of that. I had some weird skin conditions, which I'll do y'all a favor and not discuss, but I was just every day, it was like I woke up, it was like, well, what is this now? And it was weird because since I was never that bad, I never did go see my doctor. I will tell you the one reason why I probably never did. I have a very sweet but sometimes overzealous brother who was like, you have to get an oximeter. And I was like, I'm not getting an oximeter. But sure enough, I got on Amazon. 2 days later, I had an oximeter. And that's what allowed me to not completely freak out during the whole thing, because I kept checking my oxygen levels. They were perfectly fine. There was no point that they ever dipped below like the normal range. And so that is actually my number one thing that I recommend to people who get COVID. Get an oximeter because it'll take that fear away, but it will also let you know, and again, I'm not a medical professional, but I think it will let you know if you start to go south, if you have any kind of problem that maybe does need medical attention. The other thing that I really, really, really would stress to everyone who gets this is take it easy. I initially told my editor, I'm fine, I'll continue working from home. But then I thought about it and I thought, why not give myself every chance to not wind up in the hospital? And so I took 2 weeks off. I did probably go back to work a little too early. I felt like those first 2.5 weeks that I was back to work really probably prolonged things more than they needed to be. But then I took a 5-day vacation and I was perfectly fine after that. Speaking of vacation, when my husband and I, we've been good and we've not been going anywhere, but when we got this, we were like, oh, so now we're going to have immunity for at least 3 months. That's what they're saying, right? And so we were starting to look into the Caribbean. We were looking for places to go. And then reports started coming out about people getting it a second time, even here in Wichita, within those 3 months. And I was like, all right, forget it. I'll wait till this is all over. Anyway, that's pretty much our story. I said in my first-person story for the Eagle about this, I really think it's going to probably wind up being a trilogy. I really feel like there's probably an excellent chance I'm going to get it again at some point as this goes on, again, just because Joe is out and about. Not to blame him in any way. I'm hoping next time it'll go as easily as the first time, but right now I'm just considering myself very, very lucky. Thank you.
Okay, next up we have Angie Mooneyham, another survivor and a long hauler. You might want to explain what long hauler is.
Good morning, Angie Mooneyham. I apologize that I am not as prepared. I was notified this morning, and thank you to COVID, I could come down last minute to fill in because I actually have a CT follow-up scan on my lungs today, so I was able to fill in for the speaker that could not. Wow, how COVID affected me, many aspects of my life. Prior to getting COVID, I'm actually in the Kansas Army National Guard, and I was volunteering on missions around the state, preparing about like ventilators, meals, things like that with Kansas Department of Emergency Management. So I came home, no symptoms, fine, went back to work. I started to get ill mid-July, and originally was diagnosed with pneumonia and had a negative COVID test originally. I went home, stayed away from everybody, and my symptoms began to progress rapidly. And I was like, something's wrong, something's wrong. I went to the ER. Sure enough, part of my lungs had collapsed. I had double pneumonia and COVID. So they rushed me from that ER down to Via Christi. There, I had a nice stay of 8 days, 5 of them in intensive care, and I appreciate beyond words the nurse, healthcare providers, doctors that were there, because as you know, family members could not be with you. And so it could be scary. You have this virus that nobody knows about, and here you're alone. So I thank you extremely to be there. Once I healed, I guess, or could say still healing, I was released from the hospital to find out that my father had collapsed and he had stage 4 cancer. And he went into the hospital. And due to COVID, we were unable to see him. And so, again, nurses, healthcare providers, we were the family. Please tell us what's going on, how's our father? So nurses, even on that end, because of COVID, have to deal with other issues with family members when they can't speak to their loved ones in the hospital. And I regret to say that he did pass away 41 days later. Also, how COVID affected, I am self-employed. I was unable to work. And being self-employed, there's no such thing as days off. You're not getting paid. along with I was up for a deployment. I was called 48 hours after I was released from the hospital, wanting to know if I would join a deployment. And unfortunately, I had to turn it down. And that really broke my heart because I was excited to join my fellow women and men in arms for this deployment. So it affects everything. And my family got the virus also, and they had a wide range of symptoms. Some were none at all, and some were closer to the flu. But yet me, I went into intensive care. So it is quite a gamble. You just don't know how it'll affect you. And so you are constantly gambling with your life. They consider me a long hauler. As you can tell, my voice is still sounding like I smoked a carton of Lucky Strikes. I did not, unfortunately. That's COVID lungs. And so you struggle for oxygen, and many nights are very rough to sleep. Like I said, I have the oxygen meter, and I'm constantly checking. My oxygen levels were actually in the 70s and 80s for a long time. Still at nights, I still dip down into the 80s and struggle with sleep. So, and that doesn't help either with your daily functions when you are struggling for air. You might need that. But so in many, many ways, COVID has affected me, from my own personal career to my military career that I'm fearful of what my future may look like, to my family, to not being able to say a true goodbye to my father. So it's a serious thing. Sure, if you don't believe it and you don't want to wear a mask and you don't want to, wash your hands, sure, that's your right, but respect others and try to do the best you can. If you don't feel good, stay home. Even me, I had pneumonia originally. I didn't test positive for COVID, but I stayed home because I knew something wasn't right. This was beyond pneumonia. And so take care of yourself. And I agree, rest. You're not going to bounce back as soon as I hope you do, but if you don't, stay home, take care of yourself and take care of your family. Thank you.
We really put this event together for our healthcare heroes, just to say thank you to all of them. So on behalf of everyone at Sedgwick County government, thank you to all of you. This is just a small representation of those hundreds of folks and thousands of folks who are working throughout Sedgwick County to care for those who are sick. Thank you to everyone from Via Christi, Wesley, the Dole VA Medical Center, and Sedgwick County as a whole. Thank you guys so much. We really appreciate it. Next, we'd like to move into the portion that we've also worked on behalf of this event today. We've got these cards here that we are asking everyone to take with them. We will also have these on the website for folks to print off. And basically, these are signs for you to write a message on the inside. And then we're asking that you post it somewhere. Post it, take a picture, post it on your social media. Also tag Sedgwick County government, the Facebook page, Twitter, so that we can also continue to share those thank yous to our healthcare workers in the months and weeks to come. In addition to that, we will have additional items for you guys on the Sedgwick County website. Please go on there for all of the latest COVID information as things continue to go on. And again, thank you to everyone on behalf of Sedgwick County.